Memorial Imaging Center locations provide cutting-edge technology. MRI, or magnetic resonance imaging, uses special radio waves and a strong magnetic field to provide clear and detailed pictures of internal organs and tissues. There is no radiation. This procedure has proven to be very useful for the diagnosis of many types of conditions in all parts of the body, including cancer, vascular disease, stroke and joint, and musculoskeletal disorders. If you are prescribed an MRI with contrast, your procedure will include a contrast material that is given through a vein. The contrast material makes it easier to visualize certain tissues or blood vessels. Your doctor will advise if it's needed. To prepare for your MRI, your doctor may recommend that you need blood work prior to the exam. Blood work may be needed if you have high blood pressure, diabetes, or any kidney conditions. Tell your doctor about any allergies you have. This is to avoid any possible complications with the contrast dye. Tell your doctor if you're pregnant or nursing. Do not wear anything metallic during the MRI. Tell your doctor and MRI technologist about any implanted metal or medical devices that are in your body. Entering the MRI exam room with metal is not safe. Make sure you bring a copy of your prescription, your insurance information, and a picture ID. At Memorial Healthcare System, we value your time, and we make every effort to ensure that your appointment is timely and easy to schedule. You can provide us with your medical information and history before you arrive by using Memorial Healthcare System's MyChart portal. You can also provide this information when you arrive to one of our imaging centers. Upon check-in, you will be given a gown to change into. Since the MRI machine is narrow, tell your doctor before your MRI appointment if you have trouble being in a small, confined space. A mild sedative may be prescribed to bring with you. You will be asked to lie comfortably on an MRI examination table. You'll also be given the option to wear earplugs or headphones. When you and your technologist are ready for the exam, the table will be moved into the MRI unit. During the entire process, you'll be able to clearly communicate with the MRI technician. You'll hear loud tapping and thumping sounds coming from inside the machine. If your MRI includes a contrast material, the MRI technologist will take a full series of images before you receive an injection through a vein. A second round of images will then be taken with contrast. Once the images are complete, the procedure is over and you can get dressed and resume a normal day of activity. Your images will be interpreted by a board-certified radiologist who specializes in MRI and X-rays. After your test, all images will be stored and available at any Memorial Healthcare System facility. Your results will be shared with your ordering provider and will be available to you within 2 to 3 days. Patients will also have access to their test results using Memorial's MyChart portal. When you're ready to schedule your MRI and you have your physician's prescription, simply call Memorial Centralized Scheduling. An appointment can be made at your choice of imaging center locations. Your doctor can also schedule your procedure, often the same day. Appointments are available daily, evenings, and on weekends. At Memorial Healthcare System, we offer price transparency because we believe the cost of healthcare should be available before a patient makes a choice.